views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRX Tuesday, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Sonyi Lopez, and today is Tuesday, August 17th. Coming up, Assemblymember Carmen de la Rosa shares more information on the Excluded Workers Fund, a historical $2.1 billion fund providing direct cash assistance to workers ineligible for state unemployment benefits or federal COVID-related income relief. Then the CUNY Comeback Program, believed to be the largest forgiveness program, will eliminate up to $125 million in unpaid debt for at least 50,000 students. We'll discuss this and more with CUNY Interim Executive Vice Chancellor Daniel Lemons later on. After that, we'll learn more about COVID Survivors for Change, a nonpartisan nationwide community of people who have been directly impacted by COVID-19. And what are the best ways to prepare children to physically and mentally return to their classrooms in just a few weeks? Join us as we discuss this and more with our Montefiore expert. So please stick around. Open BXRX Tuesday starts now. Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. New York State recently created a first-in-the-nation $2.1 billion fund to provide direct cash assistance to workers ineligible for state unemployment benefits or federal COVID-related income relief. Joining us now to share more is Representative of Assembly District 72 and sponsor of the Excluded Workers Fund, Carmen de la Rosa. She's also the Democratic nominee for City Council District 10. Welcome and congrats, Assemblymember.
Thank you so much for having me. It's a pleasure to be here with you.
It's a pleasure having you. And we're discussing a very important topic. So the Excluded Workers Fund, can you tell us more about this historical fund?
Yeah, absolutely. I can tell you that the fund was created when we saw the sheer pain and need that existed in our community during the darkest hours of the COVID-19 pandemic, where the bread lines in our communities were around the corner and people were literally starving were it not for government intervention. We saw that many of our constituents that were in dire need were able to get access to government intervention like food and assistance to unemployment benefits. But as usual, there was a portion of the population that was left out. And that portion of the population were some of the most vulnerable. They were workers who were undocumented, workers who were not part of the traditional workforce. And those workers did not have access to neither the Trump stimulus checks that were coming in or unemployment or any other type of cash assistance in order to put food on the table. And so I got together with Senator Jessica Ramos from Queens, who serves a community that also, like our community, was at the center of the epicenter of COVID-19 deaths, and a bunch of hardworking community activists and advocates like Make the Road New York, New York's Communities for Change, and many others who formed a coalition in order for us to come together and draft legislation that would address this issue. And that's how the Fund for Excluded Workers was born.
Thank you for sharing that, Assemblymember. So we know, in Queens, as you mentioned, and here in the Bronx, we have so many street vendors and delivery workers, all of these essential workers who were kind of ignored during the pandemic. Can you share who exactly would be considered an excluded worker?
Absolutely. Literally, it's everyone who was delivering your food, anyone who was maybe taking care of children. We saw a lot of domestic workers. Street vendors were certainly hard hit. Anyone who was basically in the service industry, mostly, as I said, undocumented people or underdocumented people that maybe were in the process of legalizing their status, but were not quite there. And so these were the people that were mostly impacted. When you think about hotel workers, when you think about restaurant workers, there's always that person, the barback, the dishwasher, the people that are invisible to those with privilege. that are often left out of the decision-making table and are often left out of the benefits that we have the privilege to enjoy every single day. Those were the people that we were trying to help.
So now this fund is here to help them. What exactly is the eligibility for the funds, and what documents are needed to apply?
Yeah, so I'm going to list them out because there's a lot for the eligibility. So basically, there's 2 points of eligibility. It's residency requirement. So you have to be a resident of New York and you have to have resided in New York prior to March 27, 2020, when is really when things shut down for the pandemic. You have lost your wages or income after February 2020 because of COVID. Either you were unemployed or partially employed, or there was a COVID-related death or disability of the main breadwinner in your household. You were not eligible for unemployment insurance or any federal relief, and you have not earned more than $26,208 in the 12 months before the law came in effect. And so there's 2 tiers. There's a 2-tier system. And within that 2-tier system, there's also proof of residency. So you need documents like a non-expired driver's license or a non-driver ID or an ID NYC. There's also information to prove where that you lived in New York, like a utility bill, a bank or credit card statement, a current lease or mortgage payment, a property tax statement. You should be able to prove your identity through things like a non-expired passport issued by a foreign country or the United States. You could also have things like a marriage certificate, and other, it's a point system. So it's like kind of like when you go into the DMV, there's certain documents that have more points than others. One of the main documentations that will give you access to the first tier of the program is an ITIN number, which many people who are undocumented, they apply for the ITIN numbers through the IRS because they do pay taxes, although some people think that that is a fallacy. Many of these people do pay taxes, and they do that through an ITIN number. So you have filed your tax returns and you're able to prove that you've done that. You're eligible for up to $15,600 in pre-tax benefits. So this was a deliberate number. We wanted to bring parity between what people who were on regular unemployment received and these workers, because at the core of this project is the ability to bring parity and equity into the funds that were coming in. So a person that receives about $300 a week from unemployment insurance, over 52 weeks, the total comes out to about $15,600. Now, if you're not eligible for the tier 1, there's a smaller tier 2, which is $3,200 of total benefits pre-tax. And that's the sum of 3 federal stimulus checks. And it's a one-time payment. And, it's not what we wanted. We were fighting for much, much more. But this was what we were able to do under the restraints of a very difficult budget negotiation during the budget negotiations in Albany.
Oh, I definitely wanted to talk about that. So I know that obtaining these funds didn't come without any challenges, right? Assemblymember, can you share some of those obstacles you and other legislators had to overcome to get here?
Absolutely. Let me talk a little bit about the history and the organizing that went into actually making the fund come to a point where it hit the mainstream and people were talking about it. We had to build political pressure, not only within the institutions that we serve, but also outside of the institutions that we serve. As I like to call it, people power. So we began to organize around the Fund for Excluded Worker a year before the budget negotiations began. And that first started by doing actions, rallies, teach-ins, sit-ins, hunger strikes. At the height of budget negotiations, there were workers who went on a 23-day hunger strike in order to prove the urgency of this fund. And so, we slept outside of Jeff Bezos' apartment. I joined the workers in sleeping on a sidewalk in New York City in front of the most expensive building in here in the city, just to show that inequality that was happening. And then inside, we also had to make sure that we were forming coalitions of like-minded legislators that were going to help us push for this fund. The conversations got intense, right? Every time we talk about immigrant communities, there's always going to be a group of people that think that you're taking away from people who got here the right way to give to people who didn't. And that is absolutely false. These people are contributing to our communities. These people are serving our communities. And, in a dire moment in my family, we grew up that tú no le niegas un plato de comida a nadie. You don't deny
Así mismo.
anyone a plate of food. And
Yep.
that's what we were fighting for. That was the essence of this battle. And so we really had to battle some of those narratives that wanted to portray excluded workers as people that were trying to game a system. The insinuations that they would be scamming New York State was something that was deplorable and that came up consistently. These people are marginalized people who an interaction with the criminal justice system will cause them literally their families and the risk of deportation. No one's trying to get deported over $3,000 or $15,000. They make way more than that in a year when they actually are able to work. And so we had to deal with those narratives. We were originally asking for $3.5 billion. We were able to get the fund at $2.1 billion. Every time you negotiate, there's going to be concessions, right? It was a tough economic year where we were trying to fund things like fully funding education and funding other parts of the budget that would include access to healthcare for many of these communities. And so unfortunately, in any negotiation, you're pitting needed communities against one another, and you end up having to concede a little. So 2.1 is still a huge success because in other states like California, it was $1 million fund, a $2 million fund, $25 million fund. It was a drop in the bucket. This is the most substantial program we have across the nation, and that's why it's so historic.
Yes, it's historic indeed. So I want to know next steps, Assemblymember. Undocumented workers have long asked for pathways to citizenships. Is this a possible next step after this EWF fund came out?
Look, I think that the fight for a pathway to citizenship is always at the forefront of every fight for immigrant justice. And these fights for equity in the financial structures that exist in our city and in our state are an adjacent battle to that fight. Because obviously when people don't have the documentation they need to fully participate in society financially, right, they're always going to be excluded. The only way to have full inclusion is to include everyone and to give them that pathway to citizenship. We know that in the federal government, now we have a Democratic House, we have a Democratic president, and I'm looking forward to continuing to work with my colleagues at the federal level to build that political pressure, right? As I mentioned, every fight, you need that political pressure. I think the Dreamers, our documented youth have led the way. They have really blazed that trail for us to do the right thing. And now we need, President Biden, we need Congress, we need the US Senate to do the right thing by them. So I'm going to keep fighting for them and with them in order for us to make sure that we get there.
Yes, we know you continue being a fierce advocate for immigrant rights, and you've stood beside the documented workers who fought for this for so long. So before we go, Assemblymember, how can people find out more and apply for the Excluded Workers Fund and stay in touch with your office as well?
Absolutely. So part of the fund is that nonprofit organizations in our communities are going to be tasked with administrating these funds and helping out. So there is a list of nonprofit organizations in all of our communities that are equipped and have the capacity to help you fill out the application. I want to make this disclaimer very clear. You do not have to pay to have the application filled out. If someone asks you for a monetary contribution to fill out the application, get your documents and walk out of that office. Because they should not be doing that. And we have to be very careful because this is a vulnerable population that often is the victim of scams. So you can go to the Department of Labor website, and there you will see how the application, what documents are needed, the eligibility requirements as well. Yeah, see the link below, as well as the fundforexcludedworkers.org, which is a website that was put up by the Coalition for the Fund for Excluded Workers. And there's a lot of insight tips on how to get ready, how to prepare. You do need to have these documents in order. So before you start the application, we're asking folks to take a minute and read the materials and, reach out to our offices. You can follow me on Instagram at CN De La Rosa. I often put updates there. And also my office is in Upper Manhattan at 210 Sherman Avenue. So please come reach out to your elected representatives, get involved, and let's make sure that we do this right.
Muchas gracias, Assemblymember de la Rosa. Thank you for joining us today.
El placer es mío. Thank you for having me.
Cuídate. We're taking a quick break on Open BXRX Tuesday. We'll be right back. Welcome back. The CUNY Comeback Initiative will eliminate up to $125 million in unpaid debt for at least 50,000 students. The forgiveness program is believed to be the largest of its kind. Joining us now to discuss this and more is Interim Executive Vice Chancellor of CUNY, Daniel Lemons. Welcome, EVC Lemons. Thank you so much for joining us today.
Thank you. Great to be here with you.
Of course. So we have some exciting news to share. As people may know already, the CUNY Comeback Initiative was just launched. Can you tell us about this program?
So this program is, first of all, it's the largest of its kind in the country. We think maybe ever. It's a $125 million program that we have launched, knowing that over the course of the pandemic, many CUNY students have had a very, very tough time. They've been not only affected by the disease itself, by the pandemic, either themselves having to deal with it or having close friends and family that have been affected by it. But of course, all the financial fallout, which has fallen very heavily on CUNY students. We know from early surveys that more than 40% of CUNY students, and as you know, CUNY students mostly work to support themselves while they're studying, and about 40% of those students lost their jobs early on in the pandemic. So there's been huge financial stress on students, and that has made it difficult for them to stay enrolled. It's made it difficult for them to pay the tuition and fees that they pay. So what has meant for a number is that they really couldn't do that. And then, of course, if you can't pay your tuition and fees, it becomes a block for enrolling for a following term. And so we knew that it was many students. We think it's 50, but actually I think it's now turning out to be probably more than 50,000, maybe more like 60,000 students that are in that situation from one of the terms since the spring of 2020. So this program, what it will do is for all those students is just completely wipe out anything that's owed to the university in a tuition or fee during that time. We're doing that for many students just happening automatically because we can identify those students and we know they're eligible, and that will happen. Other students who may not have that happen automatically will then just apply, and we will be able to arrange that. So it's a very, very big program, and we've worked really hard to put it in place.
Thank you so much for sharing that. And let's break down the eligibility, EVC Lemon. So who exactly is eligible? I know a lot of CUNY students are probably tuned in and saying, does this apply to me? And they're not sure.
So it applies to all CUNY students. And the times over which it applies are starting spring term 2020. So every term from spring term 2020 through the spring semester of 2021. That's the one that we just finished before the summer. So it's over the course of those terms, including the summer sessions. And so any student who has an outstanding fee or outstanding tuition bill with the university is eligible. And as I mentioned, most of those, we think many of them will be automatically taken care of because we can identify them without them needing to do anything. But all students will be informed and will be told that they can do that. And this also, by the way, includes graduates, students who've already graduated. I think that's very important to note because, of course, quite a few students have graduated, but may still have an outstanding balance. And in the past, that would interfere, for instance, with getting a transcript sent. So that then it becomes difficult to apply for a job or to apply to graduate school or so on.
Thank you so much for distinguishing that. So where are the funds coming from?
These are coming from federal stimulus funds. You know, there were 3 federal stimulus bills that had funding in it for higher education. And they all have gone into something called the Higher Education Relief Fund, HERF. And so there's HERF 1, 2, and 3. So the first bill, CARES Act was the first one. Then we've abbreviated the next one, CRISA. And the last one, which passed most recently, was the ARPA. And so each of these 3 had funding for higher education. Actually, there was more funding in each of the subsequent bills. So substantial funding for higher education. And CUNY serving students who were identified by the U.S. Department of Education as being the ones who should receive the bulk of these funds. CUNY is receiving substantial amount of funding. Also should point out that in each of those fundings, HERF 1, 2, and 3, there is a large amount of funding that was designated to go directly to students. So we've already distributed 118 million in the first fund, 118 million in the second, and in this coming fall, and then in the following spring of 2022, there will also be even more funding that will go directly to students. That's separate from what we're talking about today, which is this taking care of fees and tuition that's owed.
Wonderful. Thank you so much for sharing that. I'm glad to share that I am a CUNY alum. I went to CUNY in Harlem, and I absolutely love the CUNY system. It's a very affordable system as is. So this is incredible news, EVC Lemons. Is the CUNY comeback a one-time fund, or will it be an ongoing, on-rolling initiative?
It is a one-time fund, which has been based on federal funding. However, one of the things that the Biden administration has really been supporting and pushing for, and we're really hoping will happen, is greater funding relief through further federal funding for students. And this would be dealing with student loans that are to either private or public lenders. And so that's a separate category. And what the Biden administration is proposing is that students who meet the eligibility requirements, which would be based on income of their families, those students would also receive, and this could even be more substantial if it were to pass than what we're able to do right now. But for now, yes, this is one-time funding. We don't have any indication that there's going to be any subsequent funding like this. The stimulus packages, given the economy has swung back around, although unfortunately not for a lot of our students and their families, but at least not yet.
What is the average student debt balance for a CUNY student that is now being erased through this program?
That's a great question, and I actually don't have that number in front of me. It's going to range quite a bit, actually. And for some students, it will be a matter of a few $100s. We know for some, though, it will be significantly more than that, well over 1,000. But I can't really give you the range. I haven't seen that range. The great thing is that we have the funding. Having analyzed this, we know we have the funding that will handle all of those students over whatever that range is.
Wonderful news. So EVC Lemons, I understand that COVID-19 has also affected enrollment and current and former CUNY students. Can you tell me a little bit about this impact that the pandemic has had on enrollment and what CUNY's hopes are for a comeback through this initiative in particular?
Well, one, we're really hoping this will help students to enroll who had maybe thought they couldn't because they had a block and were unable to because of unpaid fees. So we think that's going to help quite a few students. We also hope that students will be aware that if they enroll in the fall, they will be eligible also, and they will receive this other direct funding to them, which I mentioned already. So I think that's going to be very important too for a lot of students to realize that in addition to taking care of these fees that are owed, they will actually get more direct support. And I can tell you that in the previous allocations that we were able to make directly to students, the average was around $500 to $600 per student. Mm-hmm. Some students, though, got more. That was really what the amount they received was based on an analysis of their need, Pell status, but also dependents that they may have and so on. So it varied according to assessment of needs. Some students got over $1,000. What will be sent out in the fall will be larger than that. So I don't know what the average is going to be, but it's going to be significantly larger. Could be as much as 25, 30, 40% more. So I think also that will help students because we know that it's not just tuition and fees that students face. It's like just the basic necessities of life, right? Food, housing, transportation, these are the key things. And so this direct funding will help. So all that is to say, we know the financial piece will help students enroll who might not have been able to. And we know, the colleges that have been most impacted on enrollment are community colleges. And community colleges also have the population of CUNY students that have been the most impacted by the financial outcome from the pandemic. So it's disproportionately with community college students. And we know that's part of why we're seeing the drop in enrollment in community colleges. So again, we hope that this financial assistance will help a number of those students, and they'll realize that they really can come back to school. And we really think that's so important for them, because for students who are in community colleges or in our four-year or senior colleges, moving ahead on getting a degree is the key. We know that is the key. And it's tough in the short term, but we really are encouraging students, if they can possibly do it, to enroll, because we know in the long term, even in the short term, that's going to be the best for them.
Couldn't agree more. Definitely enroll in CUNY. Take
Absolutely.
it from me. Again, like I shared, I'm a proud CUNY alum. I went to BMCC, Borough Manhattan Community College, and then after that, City College of New York, and that's how I got where I am today, through CUNY, right? So EVC Lemons, I wanted to just get clarification on one thing. Do students have to prove financial impact, or the fact that they lost a job or something in order to qualify for this program?
So as I mentioned, there are a lot of students, I would say probably half or more, will automatically get this because they're Pell recipients, and they're in our system. We can identify them readily. And so they automatically get this. Other students who may not meet those automatic criteria then are encouraged to apply. Those students will fill out a FAFSA, which documents need. And so that's how they will become eligible. But every student's going to get something. That's one thing that we've really tried to do with this program, is make sure that every student will get something.
Wonderful. How can we get more information about the CUNY Comeback Initiative?
So we've got a really great website set up that tells about it. It's cuny.edu/comeback. So it's really easy. Just remember comeback. Tack it on the end of cuny.edu. And that is a really full set of information about who's eligible, how you apply. Lots of questions are answered on that website. So yeah, I encourage every CUNY student to go there and have a look. And you'll understand, if you're not sure about eligibility or how you're going to access this, you'll find out on that site.
Thank you so much, Interim Executive Vice Chancellor Lemons, for joining us today and sharing more about this incredible initiative.
Great to talk to you, and great to talk to a CCNY alumnus.
Thank you. Thank you so much. We'll be right back with more Open BXRX Tuesday right after this. If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311. Welcome back. We all know someone impacted by COVID in some way, whether it be through experiencing a loss of a loved one or being a survivor of the virus. COVID Survivors for Change seeks to share those stories with the world. Joining us now to share more is Chris Kocher, founder and executive director of COVID Survivors for Change. Welcome, Chris. Thank you so much for joining us today.
Thanks for having me.
Of course. So please tell us about COVID Survivors for Change and your mission.
Sure. We're a national nonpartisan movement. And what we're doing is working together to bring Americans who have been impacted by the virus. So that means they've lost a loved one, they've survived the virus themselves, and bringing them together to build community and to help them speak out to make sure the communities, have the funding, have the resources, have the leadership in place to address not just this current pandemic, but also future public health emergencies.
Thank you for sharing. So COVID Survivors for Change recently held a national movement and marched here in Brooklyn Bridge with New York nurses and hundreds of people. Can you share more about this march?
Yeah, absolutely. It was really inspired by a young woman, Hannah Ernst. She's 16 years old in New Jersey, and her grandfather had passed away from COVID. She founded an art exhibit organization called Faces of COVID Victims. She's drawn, more than 2,000 portraits of people who have died from COVID. And she had last year had planned to walk across the Brooklyn Bridge with her grandfather. And sadly, he got sick and died from COVID before they were able to do that. So she decided that she wanted to walk across the bridge to honor his life, to honor the lives of every victim from COVID and every survivor of COVID. And so we were really honored to work with her and her organization, Faces of COVID Victims, and the Yellow Heart Memorial, and really more than 15 other partner groups, including, as you mentioned, the New York State Nurses Association, to bring together hundreds of people to walk safely across the bridge to talk about what the ongoing needs of the survivor community are, and the kids who have lost parents to COVID, what they need, the long haulers, what they need, and really just to continue to raise awareness that COVID is not over and we have more work to do, not just to end this pandemic, but to support the people who have been devastated by it.
Chris, you mentioned the Yellow Heart Memorial. Can you tell us about the memorial and also the significance of yellow for COVID-19 survivors?
Yeah, absolutely. The Yellow Heart Memorial is a national grassroots memorial and a nonprofit that was started by a woman, Rosie Davis, who lives in Texas. And her mother died from COVID. And she really wanted to create something to humanize every person who has died from COVID and to put a name and a face to the number, right? So the Yellow Heart was something that started in England. And then Rosie took it here and said, let's take the Yellow Heart, which has become this universal symbol of COVID loss and survival. Let's add names to it so that we can talk about not just the numbers of the people who have lost, but their names, their stories, their faces, the lives that they've lived, and the impact that they left behind. So it started with a memorial in her backyard earlier this year, and now has grown to, this nationwide movement to call for memorialization and memorials for COVID victims all over the country. And they've displayed, thousands of Yellow Hearts. They have 8 chapters and are growing and have done incredible work to help people in their own communities memorialize their loved ones and invite the community to step into a space to support them and to honor those that have been taken.
This sounds like a movement really led by empathy and, understanding of each other. Is often something that we don't know is talk about our grief and our trauma throughout this past year. Things have happened so fast, Is there a memorial here in New York, Chris? Do we know?
There are plans. They have been working on one. I know that the city had worked on plans. I think what we'll see, hopefully what we'll see is, because, what we know from this pandemic is that it has devastated families in every single community all across America. And so my hope is that we'll see not just memorials at the national level in Washington, D.C., but memorials in cities and states all across the country, cities like New York City, which was that awful first epicenter of the pandemic last year, to really make sure that people not just have a place to know that this is being honored at the national level in Washington, D.C., but also have a place in their own community where they can go to and honor their loved ones.
Absolutely. So none of us, of course, were prepared for this pandemic, and everyone knows someone who has passed away from COVID-19 or has been affected in one way or another. I know that the group acknowledges the impact this pandemic has had on all of us collectively. How is COVID Survivors for Change advocating for all through policy change in particular?
Yeah, and you make a really good point. I mean, so many people have been impacted by this. Thankfully, I have not had COVID, and no one in my immediate family has. But in talking to all the broader community who has, we know firsthand that this community needs more support. So for the resources and the programs that have been passed to support the broader American public, let's make sure that those resources are going directly to the families and the survivors who have been impacted, so they have access to healthcare, mental health resources. We've worked for pushing for paid leave for all. The United States is one of only handful of countries who do not have paid leave. So we want to make sure that we push for that as well. And that's something that could, as soon as it's impacted, start really having a material impact on families. Supporting the children who have lost a parent. There's studies that have shown that 43,000 children have lost a parent. And so, what are we doing to show up to support them, not just now, but for the lifetime of grief and healing that they have to wrestle with? Some of those families have lost homes. And so, let's make sure that we're showing up to provide mental health resources as they go back to school next month. How are we making sure that the schools are a safe and supportive environment for them, even as direct as financial scholarships, so that they don't have to worry about college down the road. And then finally, making sure, like we said, that supporting the mission of groups like Yellow Heart Memorial to make sure that we memorialize those who have died and make sure that this never happens again.
Chris, I'm glad you shared. Fortunately, your family hasn't been affected by COVID, and that's incredible. You, as the executive director and founder, what got you started in founding this organization and doing this work at this time?
Yeah, thanks for asking that. I worked for close to a decade in the gun violence prevention movement, and I started the program there that became the Every Child Survivor Network, which is the nation's largest community of gun violence survivors working together to end gun violence. And so when the pandemic hit last year, I began to think, is there something that I can do to support the community like what I've done in the gun violence prevention space? So helping people speak out and share their stories and fight to end gun violence, building community, connecting people to support and resources. And so I really felt like this was something of a similar mission. And like you said earlier, anchored in empathy. So I jumped into this to help build out programs to do the same thing. So, we run survivor summits to bring people together and to bring in outside experts to, help people think about how they can share their story to make a difference, building community, connecting people, online, and hopefully once it's safe to do so in person, which actually that was a big part of the mission for the March, was just to give people who have, for more than a year been working together virtually and on Zoom, that space to be together safely in person. And then building programs to connect people to the support resources that they need. So we run a weekly support group called COVID Connections, where we bring in mental health professionals who, have expertise in grief and trauma to have access, so people have access to, on a regular basis, that weekly support. We've run groups for Spanish language speakers, for long haulers. We've brought in child psychology experts to talk to the parents who have either lost a co-parent or lost a child, to help them build the support network that they need and the knowledge about how to support themselves and their family. Looking ahead to back to school, again, bringing in some of those experts to talk to these families to say, here are really concrete and specific ways that you can support not just your children going back to school, but yourself as well, as your children return to school, and some of the anxiety and stress that can go with.
Oh, thank you so much for sharing. That was definitely going to be my next question about the resources and services, and you kind of just gave it to me all in one. So are the resources still available to families online? Are there upcoming events or virtual summits that people can attend? Chris, can you share?
Yeah, absolutely. If you go to our website, www.covidsurvivorsforchange.org, you can also email us at info@covidsurvivorsforchange.org. But on that website, there is a drop-down spot for trauma resources and survivor resources, and you can click right in there and sign up for COVID Connections. We do it just about every single Thursday. We've been doing it almost for a full year now, and it really is just important for people to have, whether you need it or not, that specific week, just knowing that every single week you have a safe space to connect with mental health professionals. We do about 10 to 15 minutes of learning about some aspect of trauma or PTSD or complicated grief. And then we break out into small groups to have facilitated discussions about the material and just to see how people are doing. So it's been not just an important space for people to learn about what their trauma and their pathway with grief has been, but also to connect with others who have that shared experience, so that they can see where other people are and learn from them, and also share what's been working or to ask questions to the broader group about what they can do to support themselves.
I'm so happy to hear that it's also available in Espanol for our Spanish-speaking community as well.
Absolutely.
Thank you
It's so
that.
important. Yeah. And that group is every Monday evening at 9 p.m. Eastern. And again, we think that's really important that, regardless of the language you speak, that you have access to the same level of resources and support. So you can sign up for that as well on the website.
Yes, thank you, Chris. So today we do have a doctor on the show talking about, back to school and preparing children physically and mentally for back to school. Can we just elaborate a little more on just the importance of, being present for our children, not just physically, but, mentally preparing to transition back from a year, of remote learning?
Yeah, absolutely. I mean, I think that regardless of, where you are and what this past year has been like for you, it's been an emotional year. And so for children to go back to school who, maybe lost a loved one, I mean, especially here in New York City, there's catastrophic information about the number of children who have lost a parent, a caretaker, a loved one who lived with them perhaps. And so that number is many, many times higher than it would have been in a typical year. So understanding that, under the best of circumstances, children have had a difficult year. And then, to understand that many, a very high percentage of these children have lost someone, sadly, an increasing number of children may be returning to school with long COVID themselves. And certainly with the Delta variant continuing to spread, that's going to be an ongoing concern. So how can we make sure that as children return to school, not just that the classroom is safe, we have all the testing in place and the ventilation, all the things that are required in masking to make sure that the classroom is safe, but how can we make sure that children's mental well-being is safe as well? And so that means really helping parents understand how they can be advocates for their own children, to the school board, in their child's classroom, and really helping teachers understand what the unique needs of these children may be, so that they understand that every child is coming into the classroom with a different and potentially very emotional experience over the past year. And so making sure that we're giving really concrete ways that teachers can support the kids as well through, IEP plans and 504 plans and all the other mechanisms to make sure that, the children and the families know that, the school has a psychologist on site and actually, maybe encouraging or requiring a consult or a conversation with the school psychologist. All the mechanisms that are in place, not just that we're building those mechanisms, but also that the families know about it as well.
Thank you so much, Chris, for joining us today and sharing more about COVID Survivors for Change. These conversations, I'm sure, are happening on your platform as well. Thank you for sharing.
Thank you so much for having me, and thank you for having this conversation.
Of course. So you can visit covidsurvivorsforchange.org for more information. We'll be right back here on Open BXRX Tuesday.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community, and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet. We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. A surge in the Delta variant of the coronavirus has reignited parents' anxiety. And for many, the safety and quality of schooling once again feels a little uncertain. What are the best ways to prepare children to physically and mentally return to their classrooms in just a few weeks? Joining us now to discuss this and more is Dr. Delaney Gracy, Director of Clinical Services at Montefiore School Health Program. Welcome, Doctor. Thank you so much for joining us today.
Thank you. Thanks for having me.
Of course. So, Doctor, first, please tell us about the impact this pandemic has had on our children this past year and the changes that you've seen in your young pediatric patients.
Sure. Well, obviously it's been a really tough year for kids and the whole family. So we've definitely been seeing a lot of stress, depression, anxiety in our patients. And we've seen decreases in vaccine rates, increases in obesity, and a lot of kids falling behind in school.
That is, really sad to hear. And the vaccine rates, I actually want to get into that. So I did read that routine childhood vaccinations dropped dramatically during the early months of the coronavirus pandemic. Doctor, why is this, and what risk does this pose for public health in schools?
Sure. Well, it's understandable as in the first parts of the pandemic, people were encouraged to stay home and only seek care when they urgently needed it. But because of this, kids fell behind on a lot of their routine care, including vaccines. But now you absolutely can get an appointment at your clinic and get your regular annual exam. And one of the most important things we do there is, make sure kids get all the vaccines that they need. So we are seeing delays in things like measles, and we're at higher risk for outbreaks of measles when kids fall behind like that. So we just want to make sure we catch everybody up and we're not adding that risk to, everything already ahead of us.
Right. Thank you so much for sharing.
Sure.
So I know that you focus on the holistic approach for children. So it's not just the physical health, it's also the mental health of our children. Can you share some ways to support our children in both of these ways as they prepare for back to school on September 13th?
Sure. Definitely make sure kids are getting that yearly checkup with their doctor, because that's the way we work with kids and families directly and make sure that we're doing exactly what that family needs and finding out what that child or adolescent needs, and that we're really setting them up for success. So anybody who's eligible should get that COVID vaccine for sure, anybody 12 and older, and make sure your kids understand and take the appropriate precautions like masking. But it's also really important to be as optimistic and as positive as we can for them, for the kids and for ourselves. So it's important to stay in tune with how your kids are feeling and reach out for support whenever needed for them and for yourselves.
Doctor, vaccinating children has definitely been a sensitive topic for many parents. And currently, from my understanding, only the Pfizer BioNTech COVID vaccine has been authorized for adolescents and teens ages 12 to 17. What are the facts with vaccinating children? What are some things you want to share with parents at this time?
Well, as I said before, if there's one message that we, have today, it's that everybody eligible absolutely should get that vaccine. And again, right now it's the Pfizer that's available for people 12 and up, but there are studies being done for additional vaccines for the age groups and younger age groups to be added to eligibility for the vaccines. But the most important thing that we can do to protect everyone, including those kids who are too young to get vaccinated, is make sure all of us are vaccinated. And we really need to do that to protect those kids, because the more that we delay, the higher risk it is for everybody in the communities and for spread of things like Delta or for even new variants to develop.
Right. I also wanted to elaborate now, the concern with the surge of Delta, as you said, Doctor, pairing with the start of the school year as well, there's a lot of anxiety in the air. How has Montefiore School Health Program helped support health and safety in schools in particular, especially here in the Bronx?
Sure. Well, Montefiore School Health Program now has full health centers in 32 clinics, 32 school buildings. And through that, we work with about 97 schools, primarily here in the Bronx. And so even before COVID, we've always worked with our infection control experts at Montefiore and also our partners at the Department of Health, Department of Education, to make sure that we're doing best practice infection control in our health centers and at the schools. And this includes screening, isolation, and then management of any student who becomes sick or is potentially infectious while they're at school. And one of the things we're really excited to be able to offer this year is at our health centers in the schools, we do now have rapid PCR testing that we can test for COVID, flu, and RSV right on site. And with those machines, we have definitive results within about 45 minutes. So we can really help families and schools quickly respond and, to know definitively, is it COVID or not, and then take the appropriate precautions with quarantine or just other supports.
Right. So let's talk a little bit more about preventative care. Can you tell us about the importance of well child checkups and what exactly this includes for all children and families?
I'm glad you brought that up, because it's the time of year for that. And people absolutely need to get their well child checkups. And vaccines, as we mentioned, are very important and a huge part of that. But that's not the only reason that the well child check is important. because we really talk to families to find out what they need, and we assess growth and development. So we've seen a lot of increases in weight and obesity during the pandemic. So it gives us a chance to talk about that, make sure kids are on track with nutrition and healthy lifestyles. We check for things like anemia and for lead in the younger kids. And then we screen for things like vision and hearing, all of which are really important for learning and academics in school, as well as just quality of life. And I think especially now, one of the most important things we do are developmental screening, and we look at things like speech in the younger kids. And then we also screen younger and older kids for stress, depression, anxiety, and other challenges that they're having. So once we do that, then we can figure out the exact needs for a particular child and family and make appropriate connections or referrals or get supports for people as needed. And that even includes things like food insecurity or safety issues. So it's our chance to really get to know our families and really find out what people need so we can help make those connections.
Right. Thank you, doctor. And getting to know your families as well, can you share a little bit more about vaccine hesitancy and what some of your patients have been feeling about, just insecurity with vaccinating their children in particular?
Right. And what we've been hearing, I think, is the same as across the country. Certainly some people were eager to get it and got it as soon as possible. My daughter is 13, and I absolutely got her vaccinated the first week that she was in an eligibility class. But people are worried about side effects and just worried because the vaccines are new and that, they haven't been used as long as some vaccines that we're all used to, like measles or pertussis. But they've absolutely been carefully tested, and now millions and millions of people have gotten these vaccines and done quite well. So I think the important thing to know is that the risk of side effects is extremely low, and we're all at much higher risk to become ill or have hospitalizations or complications or even death from COVID if we're unvaccinated. So the vaccine is incredibly important. You still can get COVID if you've had one of the vaccines, so you may be hearing that or talking about that in the news. And whereas this is true, the people that do get sick or get the breakthrough infections don't get nearly as sick as people who aren't vaccinated. So most of the people that are currently hospitalized or really struggling are people who are unvaccinated, and that's for kids and adults.
Thank you for that, doctor. I know that's something else that, is a confusion for a lot of people, is that in the beginning of the pandemic, COVID wasn't affecting children as much as it is now. Can you elaborate on, these new developments and the fact that children are being affected by coronavirus today?
Sure. And some of that may be because of Delta variant and that it's more contagious, more transmissible. And so more kids may be getting sick and getting infected because of that. But I think it's also because there's this huge age group of under 12 who none of them have been vaccinated. Just proportionately, we have a higher number of those kids who are the people in the hospitals now. We're doing pretty well in the Bronx right now, but across the country, we're really seeing those increases. So it's important for us to stay ahead of it as a community and protect the little ones by all of us that are eligible getting vaccinated.
Right. We want to take advantage of the fact that we have you here, a Bronx doctor. Can you please leave us with our parents and educators with a message on how to best approach the upcoming school year from your perspective as a doctor?
Sure. Well, get those vaccines. I know I said it 100 times, but that is absolutely the most important thing we can do to protect our kids, protect our communities, and get back to normal as much as possible. That's the one thing we can do. In-person learning is really important for kids and adolescents for their social and emotional development, as well as their academics. So it is really important that we all work together to make it safe for them to be able to go to school in person. I do think optimism and stress management are really important. And that means we need to take care of ourselves as parents so that we're able to do it for our kids as well. So creating those opportunities to talk, share fears, find what we're grateful for, really connect, those things are important. Get that well child check, make sure that, we've screened you and your child for everything that you specifically might need so we can do those referrals appropriately. And even outside of that well child check, if you have any concerns about stress, depression, suicidal thoughts, any mental health issues in yourself or in your children, reach out. Don't wait on that. Reach out immediately and, we can help you get connected to the support services that you need.
Absolutely. Our doctors like Dr. Gracy are here for us and our families here in the Bronx. Before we go, Dr. Gracy, can you also talk to me about the importance of the relationship between doctors and policymakers as well? You know, when it comes to transitioning back to school, doctors play a huge role in creating these policies and enacting on them.
Yes, well, and I appreciate that. And I'm happy to live in the Bronx and in New York right now because I think we've done a really good job with the policies here. The kids will be required to wear the masks in school, and that's absolutely important, especially since everybody can't be vaccinated yet. So I think some really good things have happened there, as well as getting the vaccines out for kids as quickly as possible. So we want policies to be based on science as much as possible. So we always appreciate the opportunity to advocate from the physician perspective for the kids and the families that we represent.
Thank you so much, Dr. Delaney Gracy, Director of Clinical Services at Montefiore School Health Program, for joining us today and sharing more about, preparing for back to school.
My pleasure.
Thank you. Well, that's all for our show today. I'm your host, Sonyi Lopez, wishing you and yours safety and wellness now and always. See you next time.